last time I gave this talk, I started out with just a little kind of explanation of how I got into this topic, how I got interested in it. My mother gave me in high school a book called Eat Right and Be Fit by Adele Davis. And many of you with gray hair here might remember her. She was kind of like the Jack LaLanne of nutrition. She brought nutrition to the public. When I moved here to Dallas in 1991, met my husband on a blind date, and in 1995 I was pregnant with my first child. And I had this lymph node in my neck that grew from about marble size to the size of a golf ball. And here's where I can really understand denial, because I was definitely in denial. My husband insisted that I go get a biopsy, and it came back as thyroid cancer. So then I had my baby early, and he went directly to the ICU. 3 days later, I had a thyroidectomy and neck dissection. And then a month later, I had a large dose of radioactive iodine. Normally, you use 5 millicuries of radioactive iodine to ablate the thyroid, and I got 150. The next year, there was some thought that there was still cancer in some lymph nodes, so I got another 150 millicuries of radioactive iodine. And then the year after that, there was still a suggestion that there might be something in the lymph nodes, so I got 200 millicuries of radioactive iodine. And now I feel like I'm a walking time bomb for a bone marrow disorder. And that really got me thinking back to what else can I do besides everything my doctor's telling me. And that brought me to nutrition, and mind-body medicine is really two powerful things that could help change genetic expression. About a year or two after that last radioactive iodine, my son, Church, who had gone to the ICU, started having seizures. And he eventually was started on seizure medication. Then in second grade, he was diagnosed with ADD, started on ADD medication. I'm thinking, what is the deal here? We've never had ADD and we've never had seizures in our family. But nevertheless, he was on those two medications and he stopped growing. And somewhere along that time, I had a friend in Integrative Medicine who suggested getting tested for gluten sensitivity. I went to the website to order my test, and I saw that gluten sensitivity can be associated with seizures and ADD. I thought, wow, I'm going to order a test for Church also. And lo and behold, he had it way worse than I did. And I was thinking, how come we're doing 2 medications, he stopped growing, and neither one of my doctors told me about this? We stopped gluten, and 3 days later, he was a different child. I mean, it was a really powerful, obvious example of how incredible your diet changes your genetic expression. So I'm going to show you a couple of slides here that demonstrate in a pictorial way how diet can affect our genes. So here you see a picture of Rainbow and Copycat. And Copycat is the genetic clone of Rainbow. So I first saw this slide, I thought, well, how come they don't look alike if they're genetic clones? They're genetically the exact same thing. Well, it has to do with the nutrition that they got in utero. Very important. It turns out that in utero time period and the pubertal time period are really crucial periods for turning on and turning off genes. But really, every time you put something in your mouth, you turn on and turn off genes. If you eat a meal that's high in carbs, say pancakes or bagels or toast for breakfast, you turn on genes that relate to insulin signaling. As opposed to if you eat a protein-based breakfast, you turn on genes related to formation of new proteins. So you really want to avoid those insulin-related genes being turned on all the time. But here you see a powerful demonstration of that in utero time frame. So this is a similar story. In the middle, you have the queen bee and the worker bees all around them. They have the exact same genes. What's the difference? It's that the queen bees are fed royal jelly throughout their time as larvae. The worker bees only get it for 3 days. And that royal jelly just happens to be very high in B vitamins. So B vitamins go to our DNA and they attach methyl groups, little called CH3, if any of you are chemistry fanatics here. So little CH3 groups get attached to the DNA and they basically say, don't read here. They turn that gene off. We have other compounds that say read here, but really we, just like the worker bees and the queen bee, everybody in this room has 99.99% the same genes. Our environment turns on and turns off those genes. Our environment in terms of what we were exposed to in utero, what we eat day in, day out, our experiences, what we think, what toxins we get exposed to. So compounds will come to our book of life, which again is the same for all of us, turn on and turn off genes. And here's another example of the agouti mice. This was an experiment done at Duke by a guy named Randy Girdle. And he took agouti mice, a very inbred strain of mice, so they have all the exact same genes. He fed one group of agouti mice mothers regular mouse food. Then he fed the other group of agouti mice mouse food plus methylators. So things like B vitamins, methionine, zinc, folate. And what he found was that the mothers who got the B vitamins had babies that looked like this. The mothers who got the regular mouse food had babies that looked like this. So their coat colors were different. These mice were more likely to get fat. They were more likely to die within 2 years than the little brown mice. So all those B vitamins that the mothers got while they were pregnant turned off a lot of genes in the brown babies. We can't do that kind of experiment in humans, obviously. But I think this man did some work that would show you how genes got turned on and off in humans. So Weston Price was a dentist in the 1930s in Cleveland, and he felt like he was seeing a whole lot more children who had to have braces than he did early on in his career. And he decided, he was a very spiritual man, and he thought to himself, why would God create an imperfect child? And he made it his life's mission to go out and kind of research that question. He traveled all over the world, from Peru to South Africa to New Zealand to Switzerland, New Zealand, traveled all over the world. The first thing he did was look in people's mouths and see how many cavities they had. And you'll see the way the book is listed, it's primitive and civilized. That doesn't, I'm not necessarily meaning that eating a Western diet means you're civilized, but the groups that were eating their traditional indigenous diets had close to 0% rate of cavities. The groups that had moved into town and started eating some of the more Western foods like sugar and jams and refined grains had a 40 to 70% rate of cavities. The next thing he did was to look at the next generation of these people, of the people who'd moved into town. And what he found was astonishingly similar across the board, across the world. The next generation of the people who had moved to town and adopted a Western diet had very narrow faces, often had crooked teeth, bucked teeth, and you'll see how the diet affected the genetic expression in that next generation. It's very similar across the world. So these were some Seminoles who were eating their traditional indigenous diet. And you can see they have broad maxillofacial structures, and they have straight teeth. Didn't have cavities either. So this girl is an Aboriginal princess, again, eating her indigenous diet, beautiful teeth, broad face. These people had moved into town and started eating Western diet. And you can see their teeth are basically rotting, falling apart. Let's look at the next generation. See how thin their faces are? Overbites, crooked teeth. This is a Seminole princess, crooked teeth, narrow face. I said, I know what my mother ate. This is in South Africa. Beautiful, beautiful faces, beautiful smiles, beautiful teeth. This is the next generation of the people that moved to town and started eating a Western diet. And you see how similar they look in facial structure to that first slide I showed you of the first generation? So we're actually finding out that diet and environment are really behind much of our chronic disease, of which cancer would be one. And we're finding that all these chronic diseases have more in common than they have different. As I was telling a patient this morning, your genes may load the gun in terms of predisposition, but it's your environment that pulls the trigger in terms of what gets expressed. And with environment here, we have 30 to 35% is from diet, 25 to 30% tobacco related, 15 to 20% are infectious problems like human papillomavirus causing cervical cancer, H. pylori causing stomach cancer, hepatitis B causing liver cancer. 10 to 20% are related to obesity, which I think you could include to a significant degree with diet. And then alcohol is another environmental trigger. So genes only account for about 5 to 10% directly of cancers. We do have one well-known set of genetic predisposition in terms of the BRCA1 and BRCA2 genes that increase your risk for breast and ovarian cancer. But what's interesting is that we found that the risk that's associated with BRCA1 and BRCA2 has pretty much doubled since 1940. And we think that that's related to the toxins and environmental changes that we've had since that time. So if you were born before 1940 and you have a BRCA1 gene, your risk is 24%, and now it's up to 67% for breast cancer. Louie Pasteur on his deathbed said, I've been wrong. The germ is nothing, the terrain is everything. So one of the things that we do with diet and lifestyle is we affect our terrain. We're basically affecting the soil that makes our garden and can make it either favorable or unfavorable for certain diseases to progress. So what I hope to do with this talk is describe some of the ways in which you can eat for a better fit in your genes, particularly in terms of reducing inflammation, reducing obesity, improving the quality of the fats in our diets, reducing insulin levels, and reducing our exposure to environmental toxins. So Rudolf Virchow was a very famous pathologist in the late 1800s, and he described how inflammation is associated with cancers. And eating is one of those things we can do that can dramatically reduce our inflammation, and keeping a healthy body weight can reduce our inflammation. But he described really two pathways associated with inflammation and cancer, the intrinsic pathway, the extrinsic pathway. Both are associated with increased production of cytokines that kind of create a background favorable to growth of cancer. NF-kappaB is an extraordinarily important molecule that normally resides in the cytoplasm of our cells. And it's normally hooked up with a keeper molecule. And typically what happens is if you have anything that promotes inflammation, you step on a nail, you eat a sticky bun, have a candy bar, have a bagel, anything that causes, your body only has a finite number of ways that it can respond. NF-kappaB is pretty much one of the final common denominators there. When you get exposed to one of those stressors, these two molecules separate. The keeper molecule goes away, and the NF-kappaB then goes from the cytoplasm of your cell into the nucleus, hooks up with the DNA and tells your DNA to start producing a boatload of inflammatory compounds. So that can happen regardless of what stimulates the inflammation in the first place. You with me? Yeah? So if you, just to show you how important inflammation is to the cancers, if you create a genetic strain of mice that doesn't have this molecule, there's a 75% reduction in cancers. So things that we do that promote inflammation, infections, smoking, eating too much, having a sedentary lifestyle, and then one that is difficult to get away from in today's lifestyle is chronic stress. You know, we're all connected all the time now. You don't have that time to go sit out on the porch and just do nothing, watch the sun go down. One of the other kind of things that got me into this whole field was I saw my grandmother who lived to be 100. She ate healthy, and every afternoon around 5 or 6, she'd go sit out on her porch with a glass of sherry. I mean, just a little glass, but she'd have her glass of sherry and watch the sun go down. We don't take the time to really profoundly relax like that anymore.
I might just mention with stress, most people don't think of food as causing stress for the body, but food sensitivities, like you mentioned, gluten, that really creates a lot of stress also.
It does, as does having too many calories for what we need, like the sticky bun. Sticky bun, classic example. So having too many calories, and in general, we've actually added 500 calories per person in the last 25 years to our dietary intakes. Having a high glycemic diet is probably one of the most profound changes we've had in our diet ever. Glycemic index, I'll talk about a little bit later, but it has to do with how quickly your blood sugar goes up in response to a meal. And we have so many more things in our diets nowadays that have a high glycemic index than we did even 200 years ago. We've only had farming for a very short period of time, only had grains in our diet for a short period of time evolutionarily. And then we have so many sugary foods around today that we didn't used to have. Hydrogenated oils, also a fairly recent addition to our diet in the last 100 years. Hydrogenation is a chemical process where you make fats more shelf stable, but they create havoc in your cell membranes and are associated with a number of chronic diseases, including heart disease and cancer. So we want to stay away from those. Having an imbalance of the omega-3 fats and the omega-6 fats also creates inflammation, and I'll talk more about that later. So how can we throw some water on all this inflammation? We can lose weight. We want to get rid of specifically this kind of fat here in your middle. We eat foods that have a low glycemic index, eat foods that are nutrient dense, meaning you get a lot of nutrients, either vitamins, minerals, or phytochemicals. Phytochemicals are plant compounds. You want to get a lot of those per calorie. And what you want to stay away from are nutrient poor diets where you're getting a lot of calories and hardly any nutrients. Lastly, we want to have more fiber in our diet. The average Paleolithic man had 112 grams of fiber per day. The average American gets 12. So we want to get a lot more fiber in our diet, have regular bowel movements. And then we want to increase our omega-3s. So this is kind of a photograph of an anti-inflammatory diet. The way I describe it to patients is vegetables, fruits, nuts, seeds, berries, and healthy sources of meat. So healthy sources of meat in my mind would be grass-fed, grass-finished meats, chickens that have been raised outside in the sun and in the pasture, and wild fish. But what you see here, what do y'all see? Color, lots of color. It's whole, it's not refined. It's what I call real food as opposed to fake food that man has had a hand in processing. It doesn't have to be raw, in my opinion, to be healthy for you. There are a lot of people who espouse the raw foods diet, but it really isn't for everybody. We've had fire for at least 50,000 years, so I think we've been cooking our food for a while. But I think one of the reasons that raw foods, many patients do get better with raw foods, is that they're real foods. Now somebody asked me about the flowers. Are you supposed to eat the flowers? And no, but you're supposed to enjoy every bite. Eat your food mindfully and really enjoy it. Prepare it with a sense of love and imbibe it with a sense of love too. So NF-kappaB inhibitors, there are a lot of foods that contain these molecules to inhibit inflammation. The ones where you're going to find it highest are typically the spices and the herbs. So if you're not including spices and herbs in your meals, give it a whirl, because they have many inflammation-reducing compounds in them. So turmeric or curcumin is probably one of the best well-known. Lycopene that comes from tomatoes, resveratrol that comes from grape skins, ECGC from green tea, but any spice, any herb is going to have beneficial effects for you. So, go out to your garden and grab a handful and put it in your food. Dill, oregano, basil, mint, all of them are going to have benefits.